Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What are the most common injuries you see in high school athletes playing fall sports?
Some injuries relate to being prepared for the season and some are more traumatic injuries. So the ones related to being prepared are with the fall, some people don't do a lot of work in the summertime and so they come in a little bit out of shape and a little bit weak. So that's something that we might see as stress fracture, stress reactions. As far as other injuries to knees and shoulders with the traumatic injuries, ACL tears, meniscus tears in the knee, shoulder dislocations, those are the type of injuries we see.
Is rehab time set in stone or is it a case-by-case basis?
If people have surgery and post-surgical rehabilitation is more of a set in stone thing lots of times, but there is always a little variability. With injuries that don't require surgery, there's definitely a case-by-case situation on how people are recovering.
What can coaches, trainers, and parents look for to see if their son or daughter is injured?
Coaches and trainers and parents especially see their kids and see their students and athletes every day, much more often than the doctor does. And so it's easier for them to see changes in behavior or changes in performance, how they're performing in the competition, whether they're limping a little bit or favoring a joint. Those are things that when you see a kid daily, you can pick those things up.
How has the attitude towards injuries changed?
I think there's been a definite change in behavior with schools and administrations and athletic directors in terms of appreciating the injury and the severity of injury and trying not to rush players back. If you try to get back too soon and you're not physically prepared, you definitely risk a further, possibly more complex injury that may have gone from a non-surgical treatment to a surgical type injury.